Okay. Tiffany?
Hey there. Sorry about that.
It's okay.
Oops, camera's in a weird place. Hi, everybody. Thank you so much for taking the time to join us tonight. My name is Dr. Tiffany Kilbis. I'm one of the residents here at Pomona Valley, and we're really happy to see all these faces. So thanks for having your cameras on. And this is really informal. We're just here to answer any questions that you have and hopefully get you interested in medicine. If you're not already interested in something in medicine, and if you are, great, to enhance that interest. So I'm here with Dr. Hathaway, Dr. Millie Hathaway, and she's going to just introduce herself shortly.
Hello, everybody. Thank you for that, Dr. Kilbis. My name is Millie. Please feel free to call me Millie. I am one of the second years at Pomona Valley. And again, just like Dr. Tiffany Kilbis had just mentioned, is we're here really to just be your resource. Ask us any questions that you'd like. Please feel free to have fun and ask all the questions.
Okay, give me just a second. I'm going to share my screen here, okay? Okay, can everyone see the slides? Great, thank you so much. Okay, so today we wanted to talk to you about vital signs and kind of what they are, how we use them and why they're important, and how you can take them at home, and how you can take blood pressures on your friends, family members, things like that to screen for high blood pressure. So just what we wanted to mention here is why are we kind of doing these presentations, or at least what's a couple of the reasons that we are. We are, again, residents here at Pomona Valley, so we're family medicine residents. Family medicine, it's kind of, it's really broad spectrum, meaning that we take care of children, we take care of teenagers, we take care of adults, and a big part of family medicine is providing health education to the community and hopefully preventative medicine. So we hope to really increase awareness of health topics in our community. And we also hope to engage some of the people in our community that may be underrepresented in medicine. So Latinos make up a relatively large percent of the US population, but they are not represented in the same way they are in the population in medicine. So in the regular population, about 12.5% of people are Latinos, but only 6.4% of people in medical school, and only 5% of current physicians. So our residency program does have a partnership with Bright Prospect. And when we see people in clinic, a lot of our kiddos that we see for well trials, things like that, they may be first generation college bound. So that's really exciting to us, and hopefully we try to engage them once we see them in the clinic as well. So we'd like to provide you guys with a curriculum to explore healthcare, professional, academic motivation, and increase the minority presence in healthcare careers, especially in the Pomona community, because that's where we all are. Alrighty, so what are we trying to do today? We just want to give a quick rundown of some new medical terminology, maybe associated with taking pulses, blood pressure, vital signs in general, and to teach everyone how to take a blood pressure and measure heart rate. If anyone has questions at any time, please feel free to shout them out. But if you feel less comfortable with shouting them out and having your cameras on, that's okay too. You can type it in the chat as well, but you can interrupt us at any time. We want this to be kind of a back and forth conversation if possible. Okay, so let Dr. Hathaway do this clinical case.
Alrighty, so we'll start off with these cases, and they're meant to, just spark up the conversation. And so please feel free either to unmute yourself, or if you feel more comfortable typing in the chat, whatever you prefer. So we'll start off with this 15-year-old female. She comes to the clinic for her physical. What are the initial clinical skills used in evaluating the patient? So these are some of the questions that we can ask ourselves, and what's important, and what do we start off with? I see from Alejandra, she said weight. Yes, that is actually a really good vital sign. Blood pressure, yes. So we talked a lot about blood pressure in the intro. So what does that really mean, and how does the whole picture, weight, blood pressure, including, how does that give us some clues? Anything else? I'll give it another second or two. Height, yeah, exactly. Alrighty, so we got weight, height, and blood pressure. These are really good ones to start off with. So on this slide, so it talks about what are the different vital signs, and the ones that we have provided here in the chat, height and weight, aren't mentioned, but they are still included, and they're also very important. They give us kind of a picture of how the patient is growing, how they're looking in terms of their BMI or body mass index. So what are vital signs? So they tell us, healthcare providers and just any person who is interested, what the patient's clinical status or how they're looking clinically at that moment. A lot of these numbers are a kind of a snapshot in time. They don't give us kind of a longer lasting picture of the patient's clinical status, but they do give us, like I said, like a quick picture in that moment, which is also still very helpful. So the first one is temperature, usually given to us in Fahrenheit. So normal temperature is anywhere between 97.8 to 99.1, and anything below or above that could kind of give us some clues that there might be something going on. Low temperature could still mean that someone is sick or starting to have an infection, as well as kind of like how we already know when we're feeling sick, we have a fever, we feel pretty warm. And then pulse. So pulse is technically the number that we look at, and it helps us figure out how fast or how slow the heart is beating. And normal value is as listed here, 60 to 100 beats per minute. And then respiration. So we talk about the body temperature, how fast the heart is going, but then also seeing how fast or slow a person is breathing is also very important. And you might ask yourself how you would figure out how fast a person is breathing. And so essentially you would watch for their chests going up and down. So any kind of chest rise, and anything from 12 to 18 breaths per minute is normal. And then lastly, we've talked about blood pressure and normal and versus high blood pressure, low blood pressure in previous presentations. So this first number, the top number, the SBP, is the systolic blood pressure. And if we recall, it's the pressure of how fast and the pressure of the heart pumping out to blood, and anywhere between 90 to 120 is normal. And then the diastolic blood pressure, the DBP, is the pressure at which the heart is filling at, and anywhere between 60 to 80 is their normal value. All right. Okay, we kind of talked about this already, but going into more depth. So heart rate, what is it? It's the number of times your heart beats or contracts in 1 minute. And you can get a little bit kind of clever with this. You don't have to count for 1 whole minute if you don't choose to. You can if that's easier for you. But the other thing that you can do is count for 15 seconds and then multiply that number by 4, just so that you can give yourself that minute, but you don't have to count up till that whole 60 seconds. All right, next. Okay. And then Dr. Hillis, do you want to take over for what affects heart rate?
Yeah, absolutely. So I think Millie, Dr. Hathaway already mentioned a lot of these things, but what are some things that could speed up your heart rate? Definitely exercise, feeling nervous or anxious. So some of you guys may have felt this, like when you have a big test or anything that can really make you, maybe you're going to give a presentation and you don't like to talk in front of people. So anything that makes you feel a little bit nervous or uncomfortable, you may have noticed that you feel like your heart is racing, and that's true. It's kind of due to the hormones that our body secretes when there's like what we sense as maybe a dangerous situation coming up. So definitely feeling nervous, fever. So if you have a temperature or high, like Melly mentioned, that can affect your heart rate and speed it up. Digestion of food actually makes it go a little bit faster. Things, caffeine, so anything like soda, tea, coffee, energy drinks, they have a positive effect on your heart rate and speed it up. Smoking, and what are things that slow your heart rate down? So when you're in a relaxed state, so kind of the opposite, some of the things that speed it up. If you're sleeping, athletes, their body is so efficient and their heart works so well, it's able to circulate enough blood with maybe a little bit less work. So they're really well-conditioned athletes that are used to doing a lot of exercise, their heart rate's a little bit lower than the rest of us. Being very cold, that can slow your heart rate down. And some of the things that are on this list, some people just have like arrhythmias, which is like a regular heart rate, and their heart rate tends to be a little bit faster than everybody else. There's kind of a diagram. There's a lot of places that you can measure heart rate. We usually do this manually by finding a pulse and then kind of looking at the clock to see how many beats there are in 1 minute or 60 seconds. There's other like devices. A lot of people probably know now, like these fancy watches, Apple watches, or other smart watches that will actually just measure your heart rate for you. Some other things is like a pulse oximeter. You may have seen one of these. Or maybe not. It's a little device that goes on your finger and tells you the saturation of oxygen in your blood, but it usually will tell you your pulse rate as well. But this is a diagram kind of showing you how to do the good old-fashioned way. So peripheral pulses, these are things like your carotid pulse, radial pulse, and brachial pulse. So you can see on a little diagram right here, the carotid artery is on either side of your neck. So both sides, there's a pulse there. The radial artery is on the thumb side of your wrist. And the brachial artery is in the fold of your arm, kind of opposite to your elbow. So we call it the antecubital fossa, kind of midway point, just opposite to your elbow there in that fold. So those are some of the easier places to feel pulses, but you can also feel them at these other places that are mentioned here. So the apical pulse, that's really like directly over the apex of your heart, which is kind of like the bottom of your heart and your chest. Femoral, that's really in your groin region. A lot of times we do this in newborns. It's a little bit easier to feel than some of these other arteries because the babies are so tiny and their blood vessels are as well. Popliteal, that's kind of the similar location to the one in the front of your elbow, except for it's in the back of your knee. So that kind of fold opposite to your knee, that's the popliteal artery. And then there's a couple places on the foot. This is especially important in our diabetics because we may or may not know, but in time, diabetes and having high levels of circulating sugar in the blood can negatively affect our arteries and decrease circulation. That's why you may see some family members that may have lost toes or even feet or even their whole leg because of diabetes. That's really important because a lot of people walk around with diabetes and they think they're fine, I feel fine. That's true, but over time, kind of in the background of all this, it's damaging some of our most vital organs as well as just our regular tissue and especially our arteries. So when we do a diabetic foot exam, we want to pay really close attention to these pulses. So the location here on the feet, posterior tibial, so that's on, your ankle. You have what we call a malleolus. That's that really bony part of your ankle. You have one on the inside of your ankle and you have one on the outside of your ankle. Those are your medial and lateral malleoli. And just behind the one on the inside of your ankle, there's a pulse there. That's the posterior tibial. And then just closer to the body from your big toe, there's the dorsalis pedis. So those are some other pulses. But here, I think we'll just talk about the carotid, radial, and brachial. So if you want to measure your heart rate, and you guys can all try this with me, So let me turn my camera on here, sorry. Maybe Dr. Hathaway, you could just look at her, sorry, I'm having difficulty. So she's demonstrating very good there. So she's 2 fingers, right? It's important when you're doing this to only do it on one side of your neck, because you can actually, like if you're putting pressure on both sides of your carotid, cutting off circulation to your brain, lose consciousness or pass out. So make sure you're only palpating one time at a side. So take your 2 fingers and place them over your carotid pulse. That's the one right there Dr. Hathaway is showing us. So you may feel these 2 kind of muscles. So there's these 2 large muscle bodies on either side of your neck. That's your sternocleidomastoid. Just in front of that, that's where you're going to feel your carotid pulse. So it's going to feel like a, just like a little kind of like a boom, boom, boom sensation over your fingers. Once you feel that, you would look at a clock or a stopwatch and time it for about 60 seconds. Count how many beats you get in that 60 seconds, and that would give you your full pulse. So that's what someone means when they say your pulse rate. The other way to do it is to hold it for shorter times and use math to kind of figure it out. So it's a little bit inconvenient to hold it for a full 30 seconds, but you could do like 15 seconds, for example, and multiply that by 4 to figure out your pulse rate. The other locations are the radial. Dr. Hathaway, you want to show the radial? So there she is. That's on the thumb side of your wrist. So if you follow your fist, your thumb just kind of towards your body, right there, that's where you should feel the radial pulse. And then the brachial, that again is that place kind of opposite to your elbow. In that little soft spot right there, you'll feel like some tendons. Those are, your bicep and other muscles attached there. A lot of things run through there, but you should be able to feel your brachial pulse there as well. Okay, thank you, Dr. Hathaway. Respiratory rate. So similar to the pulse rate, except for we're talking about the number of breaths in a minute. Most of these things have to do with a minute. So I know Melanie had mentioned earlier when we were talking about vital signs in general, it's a little bit it may not be intuitive. How would you know how quickly someone is breathing? It's just as simple as looking at their chest and seeing when it rises and falls. So each time it rises, that would be 1 breath. So every time a person takes a breath in, their diaphragm contracts, allowing the chest to fill with air, the lungs to fill with air, and then you will see their chest kind of rise up. Sometimes it's a little bit difficult to say that, or to see that rather, I'm sorry. So you may have your patient kind of rest their hand over their chest, and that might be able to see their hand kind of rising and falling. Might be a little bit easier than to just look at their chest. What is normal? It's a little bit different in kiddos and babies especially. Their vital signs all tend to be a little bit faster than the rest of the general population, but for adults, age 12 and older, I know age 12 to 18 is not an adult, but their physiology starts to kind of become more similar to someone who's older. And around that age, 12 to 16 breaths per minute is considered normal. Some common things that increase your respiratory rate are, again, fever. I think we notice a trend. COPD. Does anyone know what COPD is? Or have they heard of that before? No problem. So COPD, that stands for chronic obstructive pulmonary disease. This is really common in people that smoke. It usually doesn't happen till they've been smoking for a little bit longer. So usually you see this in older adults, but it can happen even with not such a long time of smoking. But it's basically, it encompasses 2 different things: emphysema, you may have heard of that, and chronic bronchitis. And it usually leads to wheezing, difficulty with breathing, coughing all the time. So if you have any like grandparents, parents, maybe that have been smoking for quite a while, you may have heard that they have emphysema. They might have to use inhalers or even oxygen. So avoiding smoking is really important. Asthma, that's almost like it's very similar to COPD, but it's not caused by really a habit. It's just kind of when our lungs tend to be a little bit overreactive to things that we come into contact with in the environment. Some of you may have this, you may have friends that have this. It's kind of like where your airways get a little bit narrow in response to things in the environment or increased mucus production. And people will often use inhalers, rescue inhalers, things like albuterol to kind of help open up the airways. So dehydration, if you're dehydrated, that can actually increase your respiratory rate. Depending on the medications, some types of overdose can increase it. Acidosis, that's really a medical term, but what it means is that your pH is low, a little bit technical. Infection, so people that have like pneumonia, even common cold sometimes can increase the respiratory rate. Heart conditions, some people, there's a whole slew of heart conditions that can cause your heart to beat fast or abnormally. Hyperventilation, some people when they have like an anxiety attack, or just anxiety in general, may feel the need to breathe more quickly. And so you may have heard some people say to breathe into a bag, and various lung conditions that we didn't talk about. So this is kind of what we already talked about on how to measure the respiratory rate. So it's defined as the number of times the chest rises and falls in 1 minute. So breathing in, again, this little picture here. So this is a really simplified image of the heart, of the lungs. On the left side here, you'll see the lungs and the trachea and some of the more narrow airways as they get down into the lungs. And then on the opposite side, this is just the ribs covering the lungs. Oops. At the bottom here, this is a diaphragm. This is a big, huge muscle that really is responsible for us to breathe. So when your body just naturally knows to do this, you don't even have to tell it to. It'll do it all on its own, but we can control it as well. It works both consciously and unconsciously. So when our body is signaled to take a breath, the diaphragm, this big muscle here, contracts and comes down. That's inspiration. That's when you see the chest wall rise. When we're breathing out, the diaphragm, that big muscle there, is going to relax, and you'll breathe out your air and you'll see the chest wall fall. So we're not counting the rise and the fall, we're just counting the rise as one breath. And again, you would just count that either using a stopwatch for the number of times in a minute, for a minute for 60 seconds, or using some fraction of a minute and then multiplying it to find the complete respiratory rate. Okay, I'm gonna turn it back over to Dr. Hathaway.
Sounds good. Okay, so blood pressure. We talked quite a bit about this in previous lectures, but for those who are joining us newly for this one, we'll talk about what blood pressure is. There's two technical terms for it and what it really means, kind of as a big picture. So, and also why it's important to care about our blood pressure. So what is it? So it's the force that the heart uses to carry blood to all parts of the body. So if you can think about the heart and how much pressure and forces are good words to really think about it, how much it needs to push all of that blood from one part of the body, the heart, all the way to the different other parts of the body. If you could think about the furthest parts from the heart, those are like your toes and your fingers. So there are two, like I mentioned, two technical ways to think about blood pressure. And if you think about the heart and how it beats, it squeezes and then it fills, squeezes and fills. So both require pressure to do that. So systolic pressure, it's that top number in blood pressure. It's the pressure that the heart uses to pump all of that blood out from the arteries, which are the blood vessels that carry blood to all parts of the body. So that pressure, if you can think about it, the heart needs a lot of it. So that's why that top number is always usually higher than the bottom number. And then diastolic pressure, that is the bottom number. You can think about if the heart is completely squeezed, it needs to fill. So that also requires pressure. And essentially that's why it's a lower number, because it's basically blood refilling. Okay, so why is blood pressure monitoring so important? So if you do have a blood pressure cuff, some of them are kind of automatic, where they are a machine that is able to take it for you. And then there are others that are manual, which means you have to be able to pump the blood and kind of sense what that top number is and then that bottom number. And what's really nice is that if you learn how to do it, anybody can do it. You can teach your other people in your house how to do it, and you can check. If you want to get really good at it, you can check yourself as frequently as you can for yourself or for your family members. We talked a lot about it in previous lectures, but blood pressure, especially high blood pressure, is important in terms of knowing how it affects different parts of the body and how it can lead to chronic disease. So we mentioned a lot about in previous lectures about how blood pressure can affect the heart. The heart itself, if you can think about it, if it's pumping so hard up against a high pressure, basically what's happening is that the heart can become really, really stressed. It can become really thickened because it's having to work so hard. For example, if you think about your bicep, and if you're working out your bicep so hard, it becomes thick. So the heart is kind of the same way. High blood pressure, like we mentioned before, also can lead to strokes in the brain. So those are also really can be really serious. And then as well as being able to know how it affects your kidneys. We talked about those. The kidneys are an important are two important organs in your body that filter out the blood. And so blood pressure itself can affect the kidneys as well. What's really important to know though is if you have high blood pressure, a lot of people don't feel very much. It's not like any other illness where you feel like you are sick. You feel like there's something wrong. You can have high blood pressure and not have anything, and that's why it's called the silent killer. So being able to know how to check blood pressure, like attending this lecture and learning how to do it, is really important. All right. So what type of equipment do we need to check blood pressure? And this is if you're going to check it manually. So one is a stethoscope, which is this device here where you hook up the two earbuds to your ears, and then that circular part is placed over the brachial artery that we talked about earlier, where you would listen for a pulse in the arm. It's the opposite of the elbow area there. And then this next equipment, a very long word. It's basically a fancy word for blood pressure cuff, but it's a sphygmomanometer. You can go ahead and try to say that on your own too at home, because it's a very long word here. But basically what it is, it's a cuff, and then there's tubing that connects to a bulb, which you would press to inflate the cuff. And then there's a reader there, kind of looks like a compass, which basically gives you the numbers to take down that blood pressure. I believe in your kits, you would have something similar to take a look to. All right, so we'll try to do this in terms of kind of explaining it step by step, but then there's also a video I believe we have to kind of put the whole picture together. But let's walk through the process here, and these pictures are actually pretty helpful in terms of knowing where to put the cuff and where to put the stethoscope. So like here in the pictures, you would put the blood pressure cuff over your meaty part of your arm above the elbow. And then so you would wrap it. There's usually Velcro to kind of make sure it's snug. And then you would place the stethoscope. It's hard to kind of show it here, huh? To place the stethoscope right there, like in that top picture there where your pulse would be, the brachial artery. And so you do need two hands for this, but if you were the patient, it's also very important to have the patient in the proper position. So you would have the patient at least sitting down and then making sure that their arm is at their heart's level. So if you can imagine me, my heart is here and my arm would essentially be kind of level with my heart. And you can do that by placing the patient's arm in your arm or on a table if that's available. Also making sure if they're wearing clothing that's a little too thick, rolling that off or asking them to take it off so that the sleeve is pretty exposed there. And then you would have them, like we have it here in the first top picture, place their hand. It shows that this patient has their hand in a fist, but actually You don't technically need to do that. Sometimes it actually increases their blood pressure. So just have them relaxed. That's kind of the most ideal situation, is to have them relaxed. And then place the stethoscope over the brachial artery. And then with your other hand, your free hand, you would then pump up that valve or that bulb. And then this is where you have to really listen carefully. And this is where it takes a lot of practice, is the first heartbeat you hear. So you would pump and pump and pump until you start to hear the first heartbeat. And that's the systolic blood pressure. That's the top number. And then it's really important to slowly, there's a little like dial on that bulb, and you would slowly deflate the cuff by turning that dial. And then while the cuff is deflating, you would actually start to hear heartbeats, heartbeats, heartbeats. And then when the heartbeat disappears, that's your diastolic blood pressure, the bottom number. After you hear that last heartbeat, you should not hear any other heartbeats after that. And that's essentially taking the blood pressure. Yeah. Next slide, Dr. Kilvis. Okay. And then these are important things to keep in mind. We talked a little bit about it in terms of making sure that your patient or whoever you're taking a blood pressure for is well relaxed. So it says here, wait 5 minutes, have the person rest. And sometimes that's hard to do, especially if you're kind of in a rush or if you're in the office and, you know, they just got there, they're running late. But the big idea is that you have them rested. And then the bottom part here, white coat syndrome, that's a big one that we see in office. And I'll jump to that one really quick because, like I said, there are a lot of different things that could increase the blood pressure if you're in an office. Even just the mere thought of getting your blood pressure taken or having a healthcare provider take your blood pressure can actually increase it without doing very much. So having a person rest for a couple of minutes is very helpful. Certain food, also smoking can actually increase your blood pressure. So making sure that that hasn't happened and at least 30 minutes can be very helpful. And then it says here you can monitor it twice a day, once in the morning and then once in the afternoon. So you can get a really good idea. You can do this every day to get really, really good data. And then sometimes, you know, it's not too reasonable to take it that often. So maybe taking it once a day or a couple of times a week, anything that makes sense and keeps it more consistent for you if you really want to get a good sense of what your readings look like. All right. And then this is a really good, I'd say, I hope the video that we show kind of gives you an idea of what it sounds like, but what the heart sounds like actually when you're listening through a stethoscope or like if you put your ear to someone's chest, it's a lub-dub and it's 2 sounds. And what those sounds stand for is essentially blood flowing through the heart, blood that gets pumped out, like when it squeezes, and then blood that is when it's refilling or when it's becoming more full. And what that essentially is if you learn about this, and you will in future classes, is the actual anatomy of the heart. The heart has different valves. And so when those valves close, certain valves close, that allows the blood to pump out. And then when other certain valves close or open, that's what allows the heart to fill. And again, like you'll learn more a little bit about the anatomy of the heart in that way, but it might be a little too technical at this moment, but just remember the lub-dub. And then there are other things that you can hear with the stethoscope also. And those are belly sounds or bowel sounds. They can sound different from person to person. It could sound like gurgling, rumbling, or growling, depending on the time of day if you're hungry. But that's basically, if you think about the stomach and all of the basically the tubing, the bowel that goes from the stomach all the way down to your anus and your rectum. That's where, your poop comes out. It's basically smooth muscles kind of contracting that liquid and the fluid that becomes stool, kind of moving it all along so that it makes its way down and out. All right. Okay. Dr. Kilvis, you want to take it away?
Sure. So does anyone have any questions? I think that's a presentation. Does anyone have any questions at all? No. Anything, it doesn't have to be related to vital signs or blood pressure.
You can also use the chat too if you feel a little shy to say it out loud.
Hey, Genesis, you have a question?
Yeah, I do. Since you guys went to school, like, what is, in your opinion, the best path to take to get to your doctorate?
I think everyone's path looks a little bit different, but some things that I will say that are really important for everybody are just trying to get involved in your community kind of early on, make that a big feature of your education, and that might look different, and it should be things that you're really interested in and passionate about, because they just really want to see that you're interested in healthcare in some way and kind of in helping your community. So it might be through like leadership through high school. It might be through volunteering at like a hospital or clinic. It might be through shadowing, even a doctor who's like a family friend, or reaching out to a community doctor to see if you can shadow. Those kinds of things are a good idea. They make, a comment whenever you look at like what they're looking for medical schools. They always say well-rounded, meaning they kind of hope for everybody to have reasonable grades. They don't have to be perfect, definitely. And a lot of people end up having to kind of go to a program maybe after bachelor's to enhance their GPA or make it a bit better. And they want people who do have some kind of volunteering experience that's usually clinical, meaning like in a hospital setting or in a clinic setting, and some leadership experience, whether that's student government, through your church, those kinds of things. Also possibly like research. So that can be any type of research. That the most common bachelor's degree is in sciences, mostly because that would fill the prerequisites needed for medical school. So a lot of people going to medical school will go into like biology for their bachelor's degree, or biochemistry or chemistry, those kinds of things. But it's not necessary. You can do whatever you're really interested in and passionate about, and that might help you stand out as an applicant, actually, because you look a little bit different than everybody else, and then just take additional classes for prerequisites. Dr. Hathaway, do you have anything that you wanted to say?
Yeah, I think that was a really, really great summary. I think Dr. Kilvis had mentioned a lot of the high points, and then just honing in and emphasizing the fact that, it's really important, not just, for your career, but for you and your own happiness and your own in your own life to drive yourself and chase your passion, because like Dr. Kilvis said, it really allows you to stand out. It really allows you to talk so freely and so enthusiastically when you're interviewing for certain positions and for medical school, for anything really, is to kind of have something that you're passionate about and that you stick with and you work really hard towards. I'm not sure if I missed it, if Dr. Kilvis had mentioned, but having a mentor is also very important. I think for me, that was one of the biggest things, is having somebody to look up to and to turn to for help, for questions. I think I wouldn't be here, I wouldn't be where I'm at without the people who helped me and believed in me. So if you need somebody to, tell you you can do this, have that person. because the road to becoming a doctor is not easy, but if it's really something that you want to do, you're passionate about, that's what you want to do with the rest of your life, it's worth it.
Awesome. Thanks, Millie. And then Brianna, I think in the chat said, what's the lowest pressure can be for the average person? So I don't want to give you guys like medical advice because everybody's a little bit different. So there's not like a magic number that we would say this is the lowest blood pressure absolutely that anyone should have. And if it's lower than this, we're really, really worried, because it depends. It depends on your gender, your age, your clinical situation, your risk of falling, your frailty, or your overall like hardiness. So some elderly people, we call them frail when they're a bit thin and maybe reaching the end of their life. But in general, and we wouldn't, this isn't generalizable, but for like a young, healthy, thin female patient, we would say like we wouldn't want to see it much less than 90 for the top number. And maybe for the bottom number, maybe much less than like 60 or 50. We rely on some calculations. Sometimes it's a little bit beyond the scope of this conversation to kind of help further see if it's really a suitable blood pressure for the person. That's the mean arterial pressure. That kind of tells us are the organs getting the blood that they need. And again, it's going to vary kind of from person to person. But another thing we do tend to rely on when we see someone with a relatively low blood pressure, anything less than really 90 systolic, really 100 for a lot of people, some people, is if they're having any symptoms of low blood pressure. Symptoms of low blood pressure are going to be things like feeling lightheaded or dizzy, feeling like you may pass out or even passing out, especially that's positional in nature. Positional meaning, is it when you stand up, do you feel lightheaded suddenly? Do you feel like you're going to lose consciousness, or do you pass out? That tells us that maybe your blood pressure is dropping a little bit too low. And maybe it's not a good blood pressure for you. Sometimes this happens too because people are dehydrated. So it's just really important for all of us, unless you have or your family member or someone you're talking to has some medical condition where they can't have a whole lot of fluid, but for all of us to stay really well hydrated, usually like 2 to 3 liters for an average person of water to prevent that. But yeah, it's kind of a case-by-case basis. But if you see any numbers that are sticking out to you, like less than 90, then whoever you're taking the blood pressure on, I would say, hey, maybe you should make an appointment with your doctor to kind of talk about it, make sure it's safe for them. Any other questions?
I have one.
Sure.
So going back to the respiratory one. So what would be like the diagnosis? There's probably several. But if you have like low respiratory breathing, so like if your breaths are shallow, or on the opposite, what if you're breathing really heavy? What are some of those diagnoses?
Sure. So there's a lot of different things that can cause irregular breathing patterns. So like slow, really slow respirations. This is kind of like if the person is on like a really sedating medication, now, I don't know if you all have heard about this opioid epidemic, kind of where people are, unfortunately, there's a high abuse for opioids, things like morphine, fentanyl, heroin. One of the things that sticks out at us if we see someone that comes to the emergency department is, did they take one of these medications? That's a respiratory depressant, so it can slow the respiratory rate. Or possibly another recreational drug in combination with some other ones. That's kind of a red flag. The other things could be like if their nervous system isn't functioning properly. And so like if they have, spinal cord injury, if they had a stroke that's affecting their respiratory center or drive. Some other things that can affect your respiratory rate or make it more irregular is the pH in the blood. So that thing we mentioned before, calling acidosis, like if there's extra acid in the blood, people will breathe irregularly to kind of get the acid off. So I don't know if anyone's heard of DKA, but it's diabetic ketoacidosis. It's something we see in our type 1 diabetics. So sometimes people that are very young that develop diabetes for for no real reason other than it's just like an autoimmune condition. Sometimes this is the first sign that we see is when they come in with DKA, and that can cause irregular respirations and that kind of shallow breathing. And that might be the thing that gets them diagnosed. So yeah, that's a few of them.
Thank you.
Thank you. Anyone else have any questions? Things they want to talk about?
Hello.
Hi.
The cake came with like a little key. Do we have to mess with it? It's an adjustment key.
I'm sorry?
The cake came with an adjustment key.
Is there a key on it? That's a great question. Do you mind just kind of, could you turn your camera on at all and show us like what the key looks like?
Interesting. I have
It's the little instructions.
It might be to either calibrate or connect the razor to the tubing, but I'm not quite sure. 'Cause I think every sphygmomanometer is different.
Sorry about that. But we don't have it right in front of us.
So the students can just ignore the key while they're doing these, while they're checking vital signs?
Yeah, that should be fine.
Okay. Anybody have any questions? This is a good opportunity while we have both doctors here. Any questions related or not related? Now is your time.
Alejandra asked, will the presentation be available to us afterwards?
Yes, I have it recorded and I will post it. It'll be posted for all grade levels in Google Classroom.
Awesome. Thank you so much. In the chat as well, I had put a link to a pretty short, it's a couple minutes video of how to check blood pressure. Might be a little bit helpful too.
All right, everyone. Well, thank you so much for joining us and interacting with us. We really appreciate it. If you guys think of any questions later, we're more than happy to put like our email, or I am. I'm sure Dr. Hathaway is as well. If you guys have come up with any questions or things that you wanted to ask that you didn't think of today.
All right. Thank you so much. We appreciate it. It was very informative. Thank you.
Thank you so much for giving us the time. I appreciate it, everybody.